How do we diagnose it? Usually it's with a lumbar puncture. So if you have an LP that's an opening pressure over 250 millimeters of water, this is diagnostic of IIH. And an LP can be done during the pregnancy. So if you have somebody that has frequent headaches before pregnancy, you are getting a workup done before pregnancy, but you haven't quite diagnosed it. That patient is still having issues with a headache during the pregnancy. You can do an LP during the pregnancy, which can be diagnostic and therapeutic as well. The thing that I will caution clinicians about is fluoroscopy. So some people do their lumbar punctures under fluoro because it's better to see to illuminate the spinal canal. But fluoroscopy in the first trimester has been associated with some birth defects, okay, because that caused a high amount of radiation, and fluoro specifically has been linked to having babies that have an increased risk of heart defects in the first trimester. So if we can avoid fluoro in the first trimester, you should. But again, you can do an LP without going under fluoro.